Hey, I'm Christy Lowe Sweat, and I'm the EHR Director here at Hometown. The grant we were awarded played a critical role in supporting our work with the Guidehouse project. Throughout our engagement, we focused on two primary areas that significantly both advance clinical efficiency and patient experience at the clinic.
My name is Greg Harrison, and I'm a managing consultant with Guidehouse. For Hometown uniquely, this was an engagement for Guidehouse that was a unique opportunity to assist a dedicated rural health provider in tackling some of the most pressing challenges facing clinics like Hometown across the country. Rural health clinics today are at the front line of a healthcare crisis. They serve communities where patients face higher rates of chronic disease, limited access, and just real barriers to care in general, whether that's traveling distances, transportation issues, reliable internet. On top of that, rural health clinics and clinics alike are being asked to do more with less. And so for Hometown, the challenge was clear with us. How do we reach and support patients wherever they are within the footprint in which Hometown serves? And how do we engage them proactively and manage them? And how can we leverage digital assets and digital tools with actionable insights to really drive change and meet patients where they are? That's where our engagement began. In shared common interest in that North Star, Guidehouse was engaged to help Hometown Health Clinic not only meet those challenges, but become a model for what is possible within the rural health setting today. Our focus was on two things. First, it was evaluating the feasibility and viability of a remote patient monitoring program within Hometown's care delivery model. We needed to be able to reach patients, and we needed to have a digital and scalable platform that is consumer friendly, but also works within the ecosystem of Hometown. We spent a great deal of time evaluating the potential partnerships with different vendors and solutions to ensure the right alignment and cultural fit for Hometown. Adjacent to that, the second thing that we did was enhance Epic's native capabilities and tools, particularly around MyChart as well as population health management tools. We set up registries, metrics, all in which to track patients for targeted interventions. We built processes to send bulk communications through Epic and to engage patients in their care. That meant we could reach hundreds of patients through a single click of a button, and inviting them to schedule visits online or through their own convenience to join educational sessions and seminars, all through native Epic functionality.
My name is Matt Cook. I'm an associate director at Guidehouse. Epic is a powerful product, and thankfully for Hometown, they already are on an Epic instance via Community Connect and had a strong set of tools to work with. At the start of our engagement, our focus with them was really helping them understand what Epic could do. Also highlight where they were underutilizing some functionality that they were already paying for. And then lastly, leverage the data and analytics capabilities within Epic to eliminate some manual processes, give them better visibility into their data, and ultimately manage their population and take care of their community more effectively. Those are the things that we focused on. We did that through a variety of factors, partnering with their Community Connect hosts, the folks that got Epic through. We advocated for them to get access to some of Epic's portals where clients can learn about Epic's features and what's available and stay up to date on new releases. And then also shared our expertise in those population health and digital health focus areas for the project. From a population health perspective, a lot of the focus for our project was around the registries in Epic that encapsulate all of the patients that make up a population, whether that's your whole clinic or disease specific. So they are your source of truth, essentially, in terms of how you see patients and can understand how you align with your quality and performance measures. So that they were a huge focus for us. We worked very closely with the Hometown team and also their Epic provider to review those line by line, setting by setting, to make sure we really understood how it was set up We made some recommendations and identified questions or concerns as those came up too that the team could address to ensure the registry was working as it should be to align with HEDIS and other measures. But those were critical because that's the tool that can really help you manage the program. If you're not taking care of leveraging Healthy Planet or those registries to its fullest, you're going to rely on manual processes rather than having Epic do the work for you. So our goal and focus was to stand up the diabetes registry with Hometown and start incorporating that to really drive the program of chronic care management, with the expectation that they could then take the playbook and steps that we did for diabetes onto other chronic diseases.
The second area that we focused on with the Guidehouse project was the MyChart engagement. All the hard work put in resulted in meaningful improvements in patient access and self-service capabilities. Through grant support and support from our BOC team, we were able to open up open scheduling and provider finder functionality. We were able to place a widget on our website that allowed patients, even without MyChart, to log on and schedule appointments with our providers. These enhancements allowed our patients to view provider availability and schedule appointments online at their convenience.
When it comes to leveraging a patient portal like MyChart or online scheduling, these things make life easier for everyone. Change management option of those tools is pretty easy because it saves time for the patient. It makes them, empowers them to be able to manage their care better with a click or through the app. So it's more about communicating what is available. And so we worked with the website and the marketing team at Hometown on the communication and education front to ensure that we were kind of shouting from the rooftops about what changes Hometown was making to improve access to care for their patients. But thankfully, from a patient perspective, it's rather easy. Their online scheduling. Once we developed scripting, and their Epic director went to every site in preparation for go lives to educate them on what was coming. Once that was done and the functionality was enabled, the online scheduling percentage grew by, I believe it was 619% between the time it went live and when our engagement ended. So there is a demand, very clearly a demand from their patients to do things like online scheduling, again, because it makes their life easier. So we were really excited and encouraged to see the kind of results that they were able to achieve in a short time.
Our MyChart statistics show that patients love this feature. I love this feature and will always continue to advance and see what we can offer for our patients. Just this next month, we're looking at rolling out a feature that's called On My Way, and this feature will allow for visibility with our urgent care services. The two main goals of our grant were demonstrated here in our MyChart engagement. The impact of these changes were substantial. The clinic transitioned from scheduling 15 to 20 patients online to beginning quarter of 2026, we were well over 300 patients booking online. Overall, MyChart scheduling has demonstrated an average of 22% increase month over month. MyChart activation has also shown sustainable improvements. At the start of our Guidehouse engagement, we were at 36% on our activation rate for MyChart. Beginning of 2026, we're now at 44%. So I know 8% doesn't seem like a lot of growth, but that's pretty substantial, and it shows that growth is sustainable for the clinic.
The engagement was very unique for Guidehouse in helping to support a really mission-driven and value-driven organization that services some of the most complex patient cohorts in a very tough environment. But what makes Hometown stand out is their mindset. Guidehouse believes that Hometown is poised for success in any direction they go because of that. Their clinical and non-clinical staff have always placed the patient at the center of everything they do. This patient-first approach is woven into every decision, every workflow, and every innovation that bubbles up through Hometown. Because of this mindset and with the continued investments that Hometown is willing to make, they can keep caring for these patients within the rural footprint. Expanding access to digital platforms and digital tools, and serve as a model for those on what's possible in the rural health setting. The Rural Health Association grant was a catalyst, uh, but ongoing funding will certainly help in building the momentum on what we've established with Hometown over the last 5 months. For Hometown, as well as other organizations across the country, keeping the patient at the center of everything you do and putting yourself in the patient's shoes to make sure that whatever investment, whatever workflow, whatever digital platform is always at the center. And with particularly with Hometown, they do that very well. What the next wave of what the future holds for Hometown is the sky's the limit. They're poised for success. Infusing their mindset with capital investments as well as opportunities for growth within their leadership and their providers. They will be able to care for a greater population and a vulnerable population through the tools, technologies, and processes in which they're developing today.
The Hometown Health team was an absolute pleasure to work with. They had clearly done their homework before engaging with us. They understood the needs of their community, the needs of their clinic, and also had a really strong partner in the Rural Health Association of Tennessee as well. So they had a strong plan going into the engagement, and then also were eager to learn. I mean, they were hungry for knowledge. They were very curious, asked lots of questions, and really wanted to understand how they could leverage Epic to its fullest abilities. They acknowledged that they had implemented it, but hadn't fully ingrained the EMR into their workflows to get to what we call a digital operating model, where you don't have it for just documentation, but it really can drive your whole processes and practice management. So it was really exciting and fun to work with them and show them what was possible and how the data and analytics in Epic especially could really peel back the curtain on some of their performance and opportunities. So it was a highlight of my career, honestly, to work with them. They were just so pleasant. The team was always willing to meet with us. They acted on, whatever task they were needed, they made sure to knock it out. And even when there was times where we were waiting on an IT resource, which is a little bit outside of their control, we would shift gears towards, how do we develop scripting for my chart activation, or what was within our control that we could continue to move the ball forward on in our relatively brief engagement with them. So it was an absolute pleasure to work with them, and hope for the opportunity to keep crossing paths in the future. In terms of thinking about what's next for Hometown, the knowledge gained about what they can do with Epic is power. So it's really exciting to see and hear in the months since our project ended how they've continued to expand things like open scheduling. They've continued to get patients enrolled in MyChart, and then also use those population health tools to get patients into the clinic and proactively manage those high-risk patients. So the results we've heard and seen have been fantastic thus far, and we expect that to continue. We talked a lot and did a very thorough analysis with Hometown around other digital health tools that could be used in a rural setting and be successful. Remote patient monitoring, or RPM, was specifically one we spent a lot of time and energy on evaluating. We did a whole business case, financial modeling to determine if that was a viable option that could be implemented. Ultimately decided the timing wasn't right, but as the landscape continues to evolve for rural health, and the payers and government respond to the quality outcomes that they see in that space, that still could be an opportunity for them in the future, and is worth monitoring as well. It was really exciting and fun to work with them, and again, wouldn't have been possible without the grant funding, just due to the nature of rural health clinics operate on a very thin margin and are often not privy to having opportunities like this. So I give Hometown a lot of credit for the planning they put into this, the focus and energy, realizing that this was a unique opportunity they were presented with. In my opinion, them and their partnership with the Rural Health Association of Tennessee, they worked really hard to maximize it and ensure that the dollar, to be good stewards of the dollars that they received.
As you can see, our project supported by Guidehouse and funded by the grant, has shown measurable and substantial benefits. These improvements have positioned the clinic for great success, delivering great quality, patient-centered care for many years to come.